show the most promise for the cardiologist?
Well, there are probably a couple, I would say. The bundling is probably the simplest because it's the most easily applicable to an episode of care, and much of cardiology is planned, so the patient's got a certain kind of heart disease, you know what their problems are from the diagnostics you've done in your office or your lab. So you plan the entire treatment of care in hospital, post-acute, etc. And you can bundle that in a way that's actually consistent with guidelines and consistent with best practices. So that's, in my view, the best. A way where you don't have an incentive to do extra care, you have an incentive to do the right thing, you share in the savings if you do it efficiently, and it's well known and planned ahead of time. An alternative would be to tie bonuses to existing fee-for-service in exchange for hitting quality targets or efficiency targets, and that's another model that also shows promise around the country.
What are some of the advantages and disadvantages of the ACO model in cardiology?
Well, the Accountable Care Organization model basically assumes that you've kind of worked out all the details among all the different players in a given area. So hospital, cardiology, other kinds of doctors, other kinds of device providers, etc. And the truth is that requires really a large amount of negotiation and I would say management. And not many places in the country are ready to do that kind of full integration, one-stop, one price for everything. So the advantage of it is if you do it, you've got worked out all the incentives, all the internal sharing of value and reward and accountability, and that's a good thing. The disadvantage is the cost of producing it, if you don't have all that worked out already, is very high. So you can spend years working out all the deals before you ever get to a single patient. So it's kind of a high startup cost.